Good morning. Thank you very much to the Sacramento County Sheriff's Office for that terrific presentation of the colors. We very much appreciate it. I am not Mac Jenkins. I say that Mac Jenkins is the former chief probation officer in San Diego County and the former past president of the California Chiefs of Probation Association. Mac Jenkins now works with us at the Council of State Governments Justice Center. We had hoped that he was going to be able to actually kick us off today. He had to stay in Southern California for family commitments. And I say that because I'm Mike Thompson, the director of the Council of State Governments Justice Center, and there's certainly no mistaking me for Mac Jenkins. Mac Jenkins, I think, is the epitome of Southern California chill. I am more the epitome of over-caffeinated New Jersey. I tell you about my New Jersey roots, and that's where I have grown up, that's where I live, because we in New Jersey are very jealous of California. And as jealousy often works, people aren't that aware when somebody else is jealous of them. We have all of our family and friends who at one point go off to study in California, or maybe they got a job in California, or they met some significant other, and then they never come back. I'm sure that there's very few people you know who have gone to New Jersey and never come back. When they go, they come back. I was actually on a flight yesterday from Newark coming over to San Francisco. The flights leave more than hourly, if you can believe it, on United. There's never an empty seat on the plane. I was in the back of the plane, and I was sitting next to a really nice woman, also from New Jersey. And as conversations often tend to happen, our talk turned quickly to our favorite son. Many of you know our favorite son in New Jersey, Bruce Springsteen, right? So we were talking about Bruce Springsteen. She'd seen Bruce Springsteen in concert 49 times. We in New Jersey talk about Springsteen shows the way I guess you talk about the Dead shows or something like that in California. We both read the book. Just finished it recently, and at one point she leaned in and she clutched my arm and she said, "You know, we almost lost him." And I knew what she meant. I said, "I know." And she said, "We almost lost him to California. He moved there for a few years." And then I said, "No, but he's back now. He's back in New Jersey where he belongs." And so that felt good and reassuring. You may not be aware of this, but in northern New Jersey, a lot of us read the New York Times. And on the front page every day of the website, there's a whole section called California Today. And on it, it says, these are the news and stories that matter to Californians. Imagine opening the LA Times on the front saying, the news and stories that matter to New Jersey, right? I mean, it just sort of wouldn't work that way. I will tell you, it's very hard to keep up with what's going on here. You're parched in drought, scorched by wildfires, and then driving in, you're inundated with water. The budget is in the red. No, it's in the black. Now you're in the red again. The Chargers don't play for San Diego. They're moving. The Raiders may go to Vegas. It's tough to keep up with it all. Rob Lowe is a pitchman for DirecTV. No, wait, now he's bashing them. And Kanye and Kim, I won't even try to keep up with what's the latest that they're doing. So I mention all that because I'm a criminal justice guy, and as much as we follow criminal justice, it is very difficult to keep up with all of the incredible trends and fast-moving landscape here in California. We try to stay up to speed with the parlance. We talk about your federal lawsuit. We talk about non-non-nons and AB 109 and Prop 47 and try to act like we know exactly what we're talking about, but for you, it's just a common vernacular. We know the prison population is down to historic lows. We know that the crime rate was down, but now it's up. We know the jail population was up, now it's down, and lots of things happening at once. And we know that a lot of these things aren't happening without controversy. There's a lot of discussion about what is good policy and what isn't good policy, and a lot will depend where you are in the state or what position you work for. But no matter who you talk to and no matter where you're talking to them, there's one point on which everybody agrees, and that is there are too many people with mental illness in jail. On that point, there's no disagreement, no matter who you talk to. And one thing that I want to point out is that we've been quoting for many years a statistic which used to elicit gasps in audience. We used to say, did you know that the institution that houses more people with mental illness than any other institution in this country is the Los Angeles County Jail? And when we would say that 15 years ago, you'd get gasps in the audience, right? Now, you get elected officials who routinely cite that statistic, their jail housing more people with mental illness than any other institution in that particular jurisdiction. California has been a hotbed of innovation. Some of the first mental health courts, crisis intervention teams, specialized probation units, wonderful and exciting new ideas that have come out of the state and in particular counties. But it's not enough. We're all here today because we recognize that it remains one of the most pressing problems facing the justice system. In fact, the question that's begged is, why does it seem like there's more people with mental illness in the justice system than there were 10 years ago, if we all know that this is such a pressing problem? And it is from that the National Stepping Up Initiative was born, where we brought together leaders in the health community and the justice community all around the rallying cry of fewer people with mental illness in the justice system. And I'll remember vividly Sheriff Hutchins talking about the launch of this initiative here in California on the steps of the Capitol, saying we need to do this not just because it's right for public safety, not just because it's good for taxpayers, but because we're talking about people's lives and we're talking about their health and their well-being. And that's what brings you all here today in this extraordinary event. And when we are probably looking at one of the most partisan times in the country as we prepare for a shift in leadership nationally, one thing that gets lost is this is an issue that's bringing everybody together. You may not have realized this, but after President Trump was elected, and after we knew we had a lame duck administration, we had a Republican-controlled Congress, Democrats and Republicans came together on a health justice issue, the Cures Act it's called, and actually passed legislation, signed into law by President Obama just a couple weeks ago on this very issue. It demonstrates that this is one of the very few issues in which people from all parties can come together, public safety and health, and do some great things. And it's with that that gives you my enthusiasm for this terrific event that we have here today, this California Stepping Up event. And the first thing that I want to do is introduce Dr. Binder, Dr. Renée Binder, who is here in California. She is a psychiatrist based in San Francisco, but most notably nationally, she is the immediate past president of the American Psychiatric Association. And it was really through her leadership that the American Psychiatric Association helped embrace this whole Stepping Up initiative, launch the Stepping Up initiative, and we have this terrific momentum today. So with that, I want to give it over to Dr. Binder.
Thank you, Mike. Good morning, everyone. Let's try it again. Good morning, everyone. Good morning. I'm Dr. Renée Binder. I'm the immediate past president of the American Psychiatric Association, and I'm also a distinguished professor and director of the Psychiatry and the Law program and associate dean of academic affairs at UCSF. And I am one of the people who came to the West Coast. I grew up in New York and came to medical school at University of California, San Francisco, and never left. And some of my friends now live in New Jersey because that's the only place they can afford to live. Right. I'm very excited to be here in support of the ongoing Stepping Up initiative as it moves into its next phase. As a California-based forensic psychiatrist, I was fortunate to be involved in the Stepping Up National Summit last year in Washington, D.C., as well as the Call to Action event on the steps of the Capitol in Sacramento. The summit and Call to Action left me feeling really energized about this cause, and I'm really looking forward to observing the progress that your teams will begin to make after today. So many presidents of the American Psychiatric Association choose a theme for their presidency: increasing research, changing education, increased collaborative care, a variety of themes. And my theme was combating the criminalization of people with mental illness. And I believe that mental health providers are part of the solution, and psychiatrists in particular can provide much-needed leadership in this area. And Stepping Up remains one of the highest priorities for the American Psychiatric Association Foundation. The director of the foundation, Dan Gillison, is with us today, coming out from Washington, D.C. For this meeting. As we kick off this event, it's good to pause to see the progress the organizers behind the Stepping Up initiative have made on this issue. So far, roughly 320 counties across the nation, which represent 38% of the U.S. population, have joined the initiative. And in California alone, 26 counties have passed resolutions to join the effort. This success is wonderful, but we must continue because there's still much to be done. As most of us in this room know, every year 2 million people who suffer from mental illness are booked in our prisons and jails, and in 44 states, including the District of Columbia, the largest public institution that houses people suffering from serious mental illness is a prison or jail. So the other thing that the incoming president of the American Psychiatric Association does is have a meeting in their hometown and then have some sort of special event. So the events have been visiting the new biotech labs. That was a few years ago. And what I decided to do was to take the members of the Board of Trustees to visit San Quentin State Prison. Many of them had never been in a prison before. It was a powerful and deeply moving experience that gave us an unfiltered look at prison life. During our tour, we were able to see the prison complex's 50-bed psychiatric hospital. The psychiatric facilities there are in great demand. In many ways, they're state-of-the-art. As you would expect, sharp angles in the halls and cells down to the door hinges and the door handles were filed smooth to prevent inmates from using them to aid in a suicide attempt. And many cells provided a sanctuary for inmates, nearly always curled up on a plain bed with a blanket covering them from head to toe. But the rooms that captivated the Board of Trustees the most were the group therapy rooms. Again, most of them had never, ever seen anything like this. There were separate enclosures that formed a semicircle for people who were at once both dangerous, but also they need and they deserve help. We briefly observed one group, and many of the people in the group actually were on condemned row. And those participating highly praised the care that they were getting. And in fact, one patient's body language told us when he had enough of our observing him and being in the room, and in a visceral way, it was clear that he valued his treatment. The 4 psychiatrists who took us on the tour and then spoke to us and answered questions were obviously compassionate and concerned about each of their patients. And at each stop, it was abundantly clear that the care provided by the staff psychiatrist was superb and professional. And even if incarceration itself is likely a detriment to many individuals' mental health, the physician-patient interactions we witnessed gave us hope. But San Quentin is the exception, and most prisons and jails around the country are ill-equipped to deal with the unique needs of inmates dealing with disorders such as major depression, schizophrenia, and bipolar disorder. I recently visited the San Francisco jail. They're actually actively recruiting for a psychiatrist to run the psychiatric services. The main jail in San Francisco needs to close down because of seismic concerns. And as Barbara Garcia in the room, the head of San Francisco's County Health Department, she and I were discussing that what they said is that what they need is a place for people to go. And I know that Dr. Garcia is working very hard to try and arrange psychiatric beds, to try and arrange for people who have mental health needs to go other places. And of course, you can prevent people from getting into the jail in the first place through diversion programs, but also to receive treatment while they're in the jail. Our correctional facilities have become de facto warehouses for people suffering from severe mental illness, in which they often cannot access treatment that they sorely need. And we've all seen how the vicious cycle of recidivism can destroy the lives of patients and their families, and not to mention the crippling effect it can have on the state and local governments, which people in this room know about, because we're all responsible for these patients. And we must act now to reverse this disturbing trend. So this is an issue for mental health professionals. It's a bipartisan issue, but it's also an issue for all physicians and all healthcare providers. We recently submitted an article to Journal of the American Medical Association on this topic, and this is one of the most distributed journals in the world. It's not a psychiatric journal, it's a general medical journal, and they felt that this issue was so important that in February they're publishing my paper with some collaborators on interrupting the mental illness, incarceration, recidivism cycle. And I think that just shows how important this issue is to not only all of us in the room, but to physicians in general. I'm here today because I know that collaboration between mental health professionals and leaders at the county and local level will be key to finding a lasting solution to this crisis. I know that together we can find an answer to this crisis and realize a goal of a California where a focus is on care and not incarceration, and that will result in better outcomes for our patients and our communities. Thank you.
Thank you very much, Dr. Binder. One of the things, again, that makes this initiative so powerful is the partnership between leaders in the health community and also people with powers over the purse strings at the county level. And with that, we are thrilled to have a well-known member of the Board of Supervisors across the state, nationally, but specifically from San Diego. He's been a terrific champion for government efficiency in San Diego County, where he's a member of the Board of Supervisors, where he was first elected in 1995. San Diego County administering a budget of $5.4 billion. He's certainly known on the national level, where he's been elected second vice president of the National Association of Counties, and we are thrilled for the terrific championship he's done of the Stepping Up initiative. I now introduce you to Greg Cox, member of the Board of Supervisors in San Diego. Supervisor Cox.
Well, thank you very much. It's an honor for me to be here today just to say really a few words of welcome and frankly, appreciation. As was mentioned last year, I had the honor to be elected as second vice president of our National Association of Counties. And I can tell you that NACO is very, very excited to be one of the three partners in this whole effort to have a national Stepping Up initiative. Our co-partners are the American Psychiatric Association and the Council of State Governments Justice Center. And between those three partners, we have really tried to focus on doing something that we think is hopefully going to be transformational in the way that we deal with our inmates and the mental health services they need. Mental illness is certainly one of the most critical problems that is facing our nation. And that is seen firsthand in our county jails. An estimated 2 million people with serious mental health issues are admitted to jails across the nation each year. Reducing mental illnesses in jails is obviously going to have to be a top priority for all of us because of that fact. When it comes to stepping up, counties are on the front line because we are positioned at the intersection of justice, public safety, and health services in our communities. We're responsible for providing treatment, supervision, and comprehensive services to millions of residents each year. We're responsible also for the fact that we are investing over $83 billion in health and community hospitals and $93 billion in justice and public safety services each year. County leaders know that treating people with mental illness and substance abuse disorders in appropriate settings is not only more cost-effective, but also leads to better outcomes for individuals in our communities. I'm glad to see so many county officials in this room here today who are passionate about making our efforts a success. Your leadership on this issue is integral to the success of local initiatives. I'm impressed that more than 320 counties so far across this country and 26 counties here in California have joined the Stepping Up initiative. Now, I'm also even more impressed that here today we have over 400 people representing 53 of our 58 counties in California, including county supervisors, administrative and executive officers, law enforcement agency officials, and certainly behavioral health service agencies and people providing those services here in this room. I urge those of you who are in this room that have not joined the Stepping Up initiative to step up, because we are going to make some big impacts in this current year of 2017. In the first year of the initiative, the 3 Stepping Up partners developed a website and a series of broad-based technical assistance tools for counties to learn from each other and engage with peers on important issues. In 2017, Stepping Up is launching a new series of webinars, network calls, conference workshops, peer exchanges, small group networking opportunities, and other peer learning activities for Stepping Up counties. In other words, there's going to be a lot to do this year. NACO will also be hosting Stepping Up educational workshops at the Legislative Conference that's coming up this next month in February in Washington, D.C., and also at the annual conference that will be held this year in July in Columbus, Ohio. We hope you will join us in all of these activities and continue to learn from experts and from your peers about the great work happening on this issue across this country. This summit is a great place to start. I want to thank the California associations who planned the summit for their leadership and for working so hard to put this event together. And special thanks to the staff at the Council of State Governments Justice Center and summit sponsors for making this event possible. Some of you probably attended the National Stepping Up Summit in April of this past year in Washington, D.C., which attracted over 50 counties from across the United States. Participants reported that they left the meeting energized and excited to return to their homes and share what they had learned from esteemed experts and peers. For many counties who attended the summit, this was the kickoff for their efforts back home. I hope that this summit here in our home state of California will have the same effect. We are doing a lot of truly great things throughout our California counties, but we know that there is much more work that needs to be done. NACO, the Stepping Up partners, and your state associations are excited to work with you and learn from you over the next day and a half. And hopefully, after the summit, to reduce the number of people with mental illness in our jails and strengthen our community support for some of our most vulnerable residents. Thank you for being here and for your commitment on this extremely important issue. The National Association of Counties has this as a priority for this next year, and I know that California counties are going to step up and also consider this a very high priority with some great ideas that we can take back and share with our other counties across the United States. Thank you for having me here, and best of luck to you.
Thank you very much, Supervisor Cox. So a few announcements and context that I want to just give you, and then we'll turn it over to our primary plenary presenter. So first, just again, in terms of the national partners that make this work, you heard about the National Association of Counties, the American Psychiatric Association and the Foundation, and the Council of State Governments Justice Center. This is a terrific partnership that spearheads the National Stepping Up Initiative. What made this particular event possible are a whole bunch of different partners, both nationally at the state level and locally. First, I just want to recognize the U.S. Department of Justice and the Bureau of Justice Assistance, which made available a lot of technical assistance ahead of the summit. We also have a number of organizations, again, both here in California and nationally, that made it possible to convene all of you in one place. The Mental Health Services Oversight and Accountability Commission, thank you. The California State Sheriff's Association, the California Healthcare Foundation, Open Societies Foundation, the California Endowment, and Synovian Pharmaceuticals. All of you made it possible to help bring us all together and feed us. We are extremely grateful. In terms of the Stepping Up Initiative nationally, we have a number of other partners to thank as well. The Jacob and Valeria Langeloth Foundation, MacArthur Foundation Safety and Justice Challenge, the Janssen Pharmaceutical Companies, Alkermes, Otsuka America Pharmaceutical, and the Elizabeth K. Dollar Charitable Trust. Thank you for making all of this possible. Why is this such a particularly big deal? Because frankly, very few states, certainly no state coming close to the size of California, have convened an event quite like this. It's the result of months and months of planning among our terrific California-based team, Hallie Fader-Tao, Deanna Adams, Elizabeth Siggins, working with so many of the associations that are represented here. The California State Association of Counties, the Chief Probation Officers of California, the California Sheriff's Association, the County Behavioral Health Directors Association of California, the Forensic Mental Health Association of California, the Council of Mentally Ill Offenders. I wish you all had acronyms with more vowels so I could say those faster, but you all know that that's a who's who. Nobody, I think, clearer than Governor Brown has made it clear that solutions have to come from local government. This is a locally driven event made possible by all those terrific associations and their staff. We didn't just simply put together an agenda and bring you here. A survey was conducted quite extensively that all the counties participated in to really help make sure we had a good understanding of the lay of the land, and for that we're very grateful. Supervisor Cox mentioned the extraordinary turnout here among counties, which is really a microcosm of the entire country when you talk about the biggest counties in the country and some of those small rural counties facing unique challenges to provide healthcare services to this population. And you know better than I, sitting around your table is a who's who of who's in your county. This is not a group that goes back and then they have to report up to a number of supervisors who are back in the home county. You have the who's who, the decision makers at the table, the Board of Supervisors, the sheriffs, the judges, et cetera, and we are extremely grateful for you coming to this. So what are we trying to achieve here? First and foremost, we all recognize that despite all of these Herculean efforts, all of these pilot projects that we're so proud of, all of these innovations, this problem seems more acute than it was before. And what has eluded us is a system-level strategy to really help make meaningful inroads. And that is what we are trying to do. We're trying to make sure that everybody here has a clear understanding of what constitutes a true system-level plan that will actually have an impact on the overall number of people with mental illness. Not a piecemeal strategy or particular programmatic strategy, but something that's truly a systems-level response. The second thing we're hoping that you're going to do is connect with experts, certainly experts nationally, but also the wonderful experts that are just here across the state and many peers who are going through experiences that you can relate to. We're also hoping that you're going to learn about additional assistance you can get coming out of the summit, as well as different funding opportunities by private and public funders alike. We also think that what must not be lost in all this are the voices of people with mental illness, their family members and loved ones. That is a key thing to hear during the course of this event, and that's something else that will happen. Most importantly is what you leave with, right? We've been to so many events where it was great while I was there, then back to business when I get back home. The idea here is to come up with a plan that you can actually take forward and operationalize over the course of the coming year. So you are very much here to work. There should be a lot of time for you to spend time within your teams and to come out with a plan that you can carry forward going home. Lastly, just some quick housekeeping announcements. First, Don't forget to join the discussion on social media by following and using, this is so embarrassing I have to read this stuff, it should just roll off the tongue, you know, but hashtag Step Up for Mental Health. That's what we would love to see you use in your tweets and your other social media announcements. Not only will your message be seen online, but we have a social media wall that will allow your messages on those screens throughout the summit. Just be sure to use the hashtag so we can show it on the screens here and outside. We're taking team pictures out in front across the registration desk for anyone that's interested. Great to show folks back home the effort that you were putting in here. Third, if you haven't downloaded the app with the agenda and all the information about the conference, please make sure that you do that. It's essential so that you can get updates throughout the course of the event and have information about what's happening. We also have a bunch of additional resources available when you use that app on your phones. And then other announcement, we are going to be doing some polling during the course of the event, asking you about your perspectives and your experiences. That will start later this morning. So with that, I think those are my housekeeping announcements. You know why this is special. You know why we're here. You know from me why we look so closely at California and why we look at it too for inspiration and innovation. Show us how it's done. Let's roll up our sleeves. Let's get some work done, and we're looking forward to it. Let's get on with it. Thank you very much.